Welcome back to Feel Good Breakfast Show. With an intro like that, when you're looking like the doctor version of Vin Diesel, you know it's going to be a fantastic conversation. The Covid-19 vaccination process, of course, this will definitely help protect you from the virus. But getting the jab might not be without any side effects. We have to be honest about that with you. And you may experience anything from redness, pain and swelling on your arm where you got your shot, to a mild headache. But these symptoms should clear within a couple of days.
Well, they certainly did for me. I felt it very mildly, and by day 2, absolutely gone now. Trusted medical expert and infectious diseases specialist and good friend, Dr. Emile Reid, is back with us in studio to give us, as always, a COVID-19 update, but also to discuss the possible side effects of the vaccine that hopefully will help to put you at ease. And if you are experiencing any side effects, we'd love to hear from you. If you've got any concerns, you can give us a call, 021 110 552. Dr. Emile Reid back in the house.
Hey,
morning, guys.
You look slightly more rested than the last time I saw you. Is that?
You think so?
I think it's on different meds now.
Yeah,
That's
maybe the adrenaline is just peaking at the moment, medication. Man. You were right in the cold face the last time we spoke to you. How are the numbers looking at the moment? Any improvement? Are you still feeling the heat?
Well, guys, good morning.
Yeah.
Fantastic to be back.
All vaccinated?
Yes, all of us, jabbed.
Jab buddies. I think the most important thing is, except for the numbers, and people look at the numbers and they say, well, things are getting better. What do we experience at the coalface, in the front lines? Things are looking horrible. It's an absolute massacre. And I'm telling you, the last 3 waves that we've been through, I think number 3 is probably the worst. Wow. And the reason for that is the people I have in my ICU and my high care unit, our hospital, are youngsters. Yeah. 30, 40, 50 years. People are dying. Families are dying. Staff are burnt out. There's no medication, there's no ventilators.
There's no beds.
There's no beds for anything else. And that's the problem that we're currently sitting with. And the one thing we do see, and what we found, is from the first 2 waves where we had majority old people getting into our ICUs, falling ill, ending up on ventilators, dying. Average age was around about 65, 67 years.
Yes.
Currently in our ICUs and high care units, average age 42.
Whew.
And I think that's the problem. And the reason why the old folk is probably not becoming that ill, because they've been vaccinated. So we still see them coming to hospital, to the wards for evaluation. They don't make it to high care or ICU, they actually go home.
Thank goodness.
So if we are looking for a bright light at the end of a dark tunnel, there's a small example of what vaccines can actually do.
I mean, that's proof right there. You can see it in terms of that average age of those who are admitted to ICUs. When we are jabbed, I think a lot of people are still apprehensive, and naturally so. Lots of questions coming through. After I got jabbed, I'm sure the same with you, Graham, it was people asking me about, okay, how do you feel? You know, what's happening with you? Is it okay? Does it hurt? And these are natural. I actually encourage the questions because I love answering them.
Did you grow? Were you taller?
I found that I grew a bit.
Is it?
Yeah. Yes, a little bit.
Graham?
Graham, you?
I grew a bit dumber. That's
probably why you asked the question.
It seemed to affect the grey matter in my head. But we joke about this because there have been so many absolute nonsense, the kind of conspiracy theories that have been flying about. Yes, we know that it's relatively new in terms of how vaccines get brought about, that this has had to happen in a very much a fast-forward kind of motion. But what are the reasonable side effects that we can expect from the vaccine?
Yeah, I just need to say, if I speak to patients, quite often I hear the story, Doc, I'm not taking the jab. I'm taking my chances. And I say, why? No, I mean, these jabs were developed and tested within less than a year. Where's the data? I'm like, I'm treating you with medication that probably has less data than what the vaccines have, and you are willing for me to treat you with those medication. Remdesivir, dexamethasone, tocilizumab, you are happy for me to put that into your body with far less support from the data than what we have for vaccines. And the most important thing is that when we listen to that, people are scared.
Yeah.
And when it comes to side effects, exactly what you guys said earlier, except for the height, is the fact that the majority, 99, probably 0.9% of side effects are transient, are there for the first day or two, and after that, there's absolutely nothing. So it's all about benefits versus risks, and the benefit outweighs the risks by far.
Yeah. When you say take your chances, there's no taking your chances with death, and that is the net outcome here at the moment. We're going to continue talking about the side effects associated with vaccinations, and I hope that you are getting your vaccination soon if you haven't already.
It's my feel-good breakfast show.
Yep, we're back on the couch with Dr. Emile Reid. We're talking about vaccinations, the possible side effects, those that are more on the extreme side, those long kind of term effects possibly, and those that the press has latched onto and fake news has blown out of proportion. Doc, thanks so much for joining us. Let's do a bit of a run through here. Let's start with I want to say the smaller side of that scale. What are some of the more minor side effects that you might experience? For instance, like a tenderness in the arm, which I certainly did feel.
Exactly. And I think the most important thing, Graham, is that when you do have mild side effects, it means something. The jab works.
It's working.
And when it comes, for instance, to something like the Pfizer jab, that we have 2 jabs 6 weeks apart, the first jab usually as what we call a primer, and the second jab as a booster. So the first one just sort of make your immune system understand what's happening, and the second one is really boosting your immune system.
Right.
And elicit that response that we need to protect ourselves against possible infection. So number one, the first side effects, normally we have painful arm, as you said. Some people on the day might feel lethargic, they feel tired, they have a headache. Some people actually complain of weird or vivid dreams the first day after they had the vaccine. And that usually just means that your vaccine is working. And usually that will last around about 24 to 48 hours. And if you have pain or fever or muscle aches or headache, just use paracetamol, drink a lot of water, and just relax.
Okay. Let's talk about the more extreme stuff, because, and we started reporting on this when the vaccination wave first started emerging globally. The more extreme side of things like blood clots, for instance. Talk me through what are the big fears when it comes to the vaccinations, and what are reasonable fears, and put it into context for us if you can.
So what's the first thing that bothers me about our vaccination drive currently in South Africa? We are vaccinating people during a pandemic. So that's probably the worst thing you can do. So whatever we put in people's arms currently will only help us when the fourth wave arrives. So it's not going to help us to get through this.
As we see with the elderly population now.
Exactly. And the most important thing is to distinguish between, am I developing COVID or do I have side effects of the jab? Okay. So usually where the side effects will just disappear after 24 hours, if you have COVID, the symptoms and signs will continue after 3 to 5 days. Okay. And because there's a likelihood that you already have the virus inside of you and you were already infected by the time you received the jab, you need to see your general practitioner and ask him to do a test. So the vaccine didn't cause that infection, you were already infected.
The virus was there.
Then when it comes to particularly the Pfizer jab, and we have seen internationally that in young people, age 12 to 29, they found after the second jab, they developed something we call a myocarditis or a pericarditis, which means that there's inflammation in the heart muscle or inflammation of the membrane surrounding your heart.
Okay.
So that is very, very rare, usually in males more than females, aged between 12 and 29, and it was described in about 40 out of 1 million cases.
40 out of a million.
A million.
Okay.
Very mild, usually gets better on its own, presents with shortness of breath, chest pain, increased inflammatory markers, and usually respond to conventional treatment of the fever, inflammation, pain, etc., with rest. Okay. Usually that sort of gets better. With the Johnson & Johnson, you remember that there was about a 2-week pause on the Johnson & Johnson jab. And the reason for that was that it was found again in ladies more than gentlemen, thrombosis, an illness caused TTP or TTS, which means thrombotic, meaning clot formation. Second T, thrombocytopenic, which means a very low platelet count, which means you can bleed as well.
Okay.
And purpura, P, which means that you develop a specific type of rash associated with the low platelet counts and also with the thrombosis. And that was described in ladies between the age of 18 and 48. And how they presented was either swollen calves, swollen legs, painful, red, warm, or they developed severe headaches that didn't respond to conventional treatment, which meant that they have a cerebral or brain thrombosis causing that headache. Other people develop abdominal pain, where they have severe thrombosis of their massive blood vessels called the inferior vena cava. And the important thing is that was described in round about 6 out of every million cases that were found.
6 out of a million.
And the majority of those people also had other conditions that predisposed them to develop these complications.
Okay, 6 out of a million. So if you're worried about blood clots as a possible side effect, just take that on board. Dr. Emile Reid, we're going to see if we can sneak in one more chat with you, but we have been talking about the vaccine and why it is so important to get vaccinated now that we are opening that up. I've done it, Doc's done it, so many people I know have done it with minor side effects. The opportunity is there, go and embrace it.
It's my feel-good breakfast show.
Welcome back as we wrap up our health discussion this morning with our infectious diseases specialist and good friend, Dr. Emile Reid. Still with us, we've been chatting about vaccinations. We've established that the risks are far outweighed by the benefits. We've seen it proven with our elderly population, how the vaccinations have helped them, looking at the current numbers. You're in it, man. You're in the fire. You're working in this space day and night, literally, for the last few weeks. Now, what is your final piece of advice for anyone who is weighing up, who is still considering not taking the vaccine?
Graham, I think number one, vaccines are not perfect, you know, and the vaccines we currently have for COVID-19 is not perfect at all. The most important thing that we need to do, number one, weigh up risk versus benefits. Number two, there will always be anti-vaxxers. That's good.
Yeah.
But when it comes to those that are still hesitant whether to take the vaccine or not, we are actually speaking to them.
Yeah.
And number three, people need to be reminded that our only way out of this dilemma we find ourselves in with overcrowded hospitals, losing family members, losing loved ones, is to actually vaccinate.
You've got to do it, and you've got to do it now that has been opened up to so many more people. I don't know if you want to end off with just a warning to where people are at the moment, because I kind of feel like we might have tapped out a little bit to just how crazy is the situation on the ground floor at the moment.
Things are horrible. You know, for the last few decades that I've been a specialist in an ICU, in a high care setting, in infectious diseases, this is the worst I've ever seen. It's a massacre. We need to end this, and the only way to end it is to vaccinate.
You've got to go and get the jab. Dr. Emile, please stay safe, my friend. Keep doing the incredible work that you are doing along with everyone working on the front lines. Now that it is available to us and we have those structures in place, go out and get vaccinated if you can.